Hello everyone, and a very warm welcome to you. Thank you for setting aside time to join this APMEN Tech Talk webinar. Dr. Porn at our Singapore APMEN headquarters very kindly told me that as of maybe 10 minutes ago, we had about 516 people from 65 countries that have registered for this Tech Talk. Once again, with a strong representation from the Asia Pacific region, which is exactly what we want. So that's really great. 516 people, that's very close to our previous record of about 530 people, but typically only about half that number actually attends. But, you know, half of 516, that's a very decent number of people listening in. A good audience to interact with, and we hope you're going to find it interesting. What I'd like to mention is that these Tech Talks are a product of APMEN, which stands for the Asia Pacific Malaria Elimination Network. And this network embraces the national malaria control programs of 21 member countries in Asia Pacific, as well as 52 partner institutions. The APMEN Secretariat works very closely with these partners to facilitate regional collaboration and advocacy and support elimination in Asia Pacific. This webinar, our webinar today, is going to focus on the IVCC Indo Pacific Initiative, which is funded by the Australian Department of Foreign Affairs and Trade, DFAT. The initiative embraces several partnerships to evaluate and make accessible an expanded vector control toolbox in the region. IVCC stands for the Innovative Vector Control Consortium, in case you did not know. Our speakers are going to share how several projects are developing evidence on forest packs containing bite prevention tools in the Greater Mekong Subregion, and on the use of indoor residual spraying, spatial repellents, and larvicides to complement insecticide-treated nets in Papua New Guinea. These are, of course, all highly relevant projects that will provide valuable evidence for improved vector control approaches, not just in Asia, but also in Africa and elsewhere. So I'm sure we all congratulate the various project teams and thank them for taking time to explain to us what they are doing. But just briefly, some comments on the webinar process we're about to start off. We will have 3 PowerPoint presentations back to back. This will be followed by the usual question and answer session. I'd like to encourage our audience members to submit written questions during the presentations. Please use the question box, not the chat box, please. I also suggest you precede your question with the name of the panel member you would like to respond to your question, if you have a preference for a particular person, that is. So for example, Rebecca, and then your question. After the Q&A session, there's a very short poll just to assess your opinion of the webinar. It's very short. 1 minute of your time, but it helps us, and I'd be grateful if you can just quickly tick the appropriate boxes. Please note that this webinar is being recorded, and as usual, it will be made available on the APMEN and the ORIN websites within a day or so. The details of these websites will be screened or made available in the chat box during the course of the presentation, in case you'd like to mention it to friends and refer them to the website in case they may be interested in watching as well. So our first presentation is going to be by Frederick Yeomans, who will talk on the IVCC Indo Pacific Initiative. And this talk will set the background and the context for the other talks as well. Fred is a project manager at IVCC, and his responsibilities include managing the Attractive Targeted Sugar Bait Development Project and leading the Indo-Pacific Initiative. Fred is also involved in the market access of new IRS chemistries in sub-Saharan Africa. He graduated from Warwick Business School with a master's degree and from the University of Nottingham with a master's in arts. Sorry, the first one was MSc from Warwick and an MA from University of Nottingham and a BA there as well. He joined IVCC from the Liverpool School of Tropical Medicine, where he managed maternal health projects in various African and Asian countries. Phew, I'm talking too much. Thank you for your time, Fred. Over to you. Thank you.
Thanks, Leo, and good morning, good afternoon, good evening to everybody on the call. Let me share my screen. Leo, can I just check with you? Can you see that okay?
Yeah, and it's full screen as well, so that's great. Thank you, Fred. Please proceed.
Okay, great. Thank you very much. So I'm just going to give an overview of IVCC and the Indo Pacific Initiative before handing over to Neil and Rebecca, who are going to go into a lot more detail about their projects. So for those of you who aren't familiar with IVCC, we are a product development partnership focused on developing and bringing to market new vector control tools. We facilitate the development and delivery of those tools to address the main problem. The main challenge that we're facing is insecticide resistance, and we also develop those new and novel tools to address transmission gaps. For example, outdoor transmission gaps when people aren't inside, protected by a bed net, for example, or IRS. So we work with a number of different funders now to address market challenges. The vector control market is not a particularly attractive one to vector control tool manufacturers. So we work with our funders to try and de-risk the innovation needed to develop those new tools. We have an innovator and expert community external to IVCC, which support our product development projects. To the manufacturers and other collaborators, we provide a technical project and product management platform to support those projects. We always say that we're small r and little d, so we're focused on development and we're impact driven. We focus more on, tend to more focus on downstream projects rather than the real upstream research projects. So that's why the focus is more on development than research. And we also work with a number of different partners and stakeholders who are engaged in education and advocacy more broadly in the vector control community. So this slide describes our product development portfolio, and don't worry, I'm not going to go into all the detail here, but I will just sort of pick out a few key things to draw your attention to. So the yellow boxes mainly at the top refer to the IRS products that in varying degrees we've worked with manufacturing partners to develop and bring to market over the last 10 to 12 years. Our driving principle in terms of product development projects is to develop this idea of a toolbox. So countries and donors have access to a range of new novel products which help them with their IRM and IVM strategies, and also the fact that we have multiple products available helps to make the market competitive and brings down prices again for those countries and those donors. So IRS has been a big focus of IVCC, as I say, over the last 10 to 12 years. We still have a number, two more IRS products to come to market in the next year or so in the BASF Silando and Mitsui Vectron T500 products. But our focus for the foreseeable future is on our net portfolio. So our net portfolio sits now atop a process of chemical screening. So that's represented by the green boxes there, that has identified a number of candidate AIs, which are still in development and testing, and we're planning to bring forward a number of those and launch them as nets with our manufacturing partners. Some of those candidates are still confidential, so that's why you'll see the crosses in the boxes. But that's the focus for IVCC's net strategy over the excuse me, over the next 10 to 15 years. So when these products are brought to market, we also support the market entry of those products. So the perforated red box at the top refers to the Engineers project, which was a market intervention which supported the market entry of those 3 IRS products with a co-payment mechanism. The Interceptor G2 dual AI net, which was the first of its kind, was also supported in its market entry by a similar project called the New Nets project, which again used a co-payment mechanism to ease the market introduction of that product. And as we move forward with the net strategy and the introduction of other vector control tools, we'll also be looking at other similar market interventions. One last thing on this slide that I'll draw your attention to is the purple box at the bottom, which refers to ATSB. So this is our kind of flagship outdoor transmission, outdoor control project as well. So that's how the portfolio looks historically, as I say, over the last 10 to 12 years and looking forward into the future as well. And as I say, the driving principles are creating a toolbox with a range of products, a range of AIs which support IRM and IVM, and also support market competition. So going down into this project that we're talking about now, the IPI project, it started in 2018 when we received the grant from DFAT, which is about developing a vector control toolbox for the Indo Pacific region. So building on what we know from our work in Africa, trying to apply that to the Indo Pacific region, and also building feedback loops so what we learn in Asia can also be fed back into the work in Africa. And one of the first things we did was to create an advisory group of regional experts in the Asia Pacific region to support this work. And there's a couple of photos there of some of the meetings we've had over the years. The second thing that we did was to commission 3 landscaping reports to help us identify the major challenges related to vector control in the region. So some of these challenges, I would say probably all of these challenges won't be a surprise to most people on this call, but for an organization like IVCC, whose work traditionally focused on sub-Saharan Africa, it was really important for us to do our due diligence on the region, learn from experts in the region, and really test our assumptions as well around vector control before we made our investments in the projects that we thought would be impactful. It's also worth saying as well that these challenges relate to the control of malaria in the region. We obviously know that Aedes-borne disease is a huge threat and a growing threat in the region. For this first kind of this first range of activity in the region, we took a decision at IVCC to really focus in on malaria, again bridging from our experience in Africa. Going forward, we're very keen to explore activities related to the control of Aedes-borne disease. But as our first foray into this geography, we were keen to really bridge from our expertise and experience in malaria control. So in terms of these key challenges, I'll just run through them quickly. In terms of the sort of geographic aspect, we're aware obviously that residual forest malaria in the GMS is a threat and a problem, as well as rising malaria cases in PNG and the Solomon Islands. Outward transmission is obviously a challenge. There's a number of hard to reach at-risk populations in the region as well. There's some insecticide resistance in Anopheles strains, but the resistance data between countries is sometimes patchy. Again, in some areas there's a dearth of testing facilities and surveillance. So some countries have great infrastructure, other countries less so. So that's variable between countries. As are the regulatory systems and the registration processes between systems. There's often, in some countries, slow registration times for vector control products, and this is similar to what we see in some of the African countries as well. And there's also a very large semi-regulated consumer market, which is a key feature of the vector control economy in the Indo-Pacific. A really, really big consumer market for some tools, particularly bite prevention tools. And in that market, products are of varying quality. Some are very good and some less so. So these are some of the key challenges that we pulled out. We digested those internally and with our advisory group, and building on that, these are the 3 projects and the 3 investments that we have made under this grant. So the BITE project, Neil's going to talk about later on. It's led by the UCSF MEI with a number of different partners in the region. Focuses on Cambodia, and there's also been semi-field testing in Thailand. Obviously, the scenario there is an elimination scenario in the forest, and what Project BITE does is evaluate the use of bite prevention tools delivered by forest packs to at-risk groups in the forest, and those forest packs contain a spatial repellent, treated clothing, and topical repellent. So we're looking to identify what would be the improved forest pack tools that could go to those at-risk groups as part of a donor scale-up of forest packs. In the NATNAT project, which Rebecca's going to talk about later on, that's within the scenario of rising malaria cases in PNG, and it's a broader-based project in PNG, looking to build a framework for the rapid assessment and adoption of novel vector control tools. So we're working with PNG IMI there, and also Burnett Institute and James Cook to support capacity development at IMR, so they're able to conduct lab, semi-field, and field evaluations of novel vector control tools. The tools that we're looking at are IRS, spatial repellents, and larvicides. And again, we want to arrive at proof of concept of these novel tools in PNG and work with all appropriate stakeholders to scale up use of those tools as part of the national program. Related to that, and this is the last piece of last project, we're working with Imperial College on a mathematical model to predict the impact of these new vector control tools in PNG and also on the other side of New Guinea on the Indonesian side. So there's also a modeling element to Project BITE, which I think Neil may touch on, but that's kind of within that project. But we have a separate investment here with Imperial College centered specifically on PNG. So they're the three main projects as they stand at the moment. And this is just a slide which describes a bit of the overall strategy of IPI. So we're working to strengthen both malaria control and elimination efforts in the region. And there's also, as I say, a number of key feedback loops into our work in Africa. So a lot of what we're doing in Asia will provide learning to Africa. So specifically from Project BITE, we're developing evidence on outdoor tools and standardized testing methods, which will be of use in Africa as we move to elimination scenarios, hopefully in a number of different countries. It's also applicable in humanitarian emergencies, so refugee camps, and working with other mobile and migrant populations as well. So that's one of the feedback loops there. In terms of what we're doing in PNG, if we're successful and we're able to introduce and expand the use of IRS, for example, this will contribute to expanded and more stable markets for novel vector control tools globally. So that again is how the work in the Indo-Pacific is linked into the work in Africa, and they all complement the whole. This is my last slide, so we're going to hear obviously a lot more about these projects. I won't go into huge amounts of detail here, but in terms of progress so far, since 2018, obviously, as I said, advisory groups have been formed, landscape studies completed. In NATNAT, the new laboratory and insectary have been built, new semi-field systems have been built. There's been a range of new entomology staff recruited and trained at IMR, and the IRS community trial started last year as well. In BITE, there were semi-field trials completed in Thailand, user acceptability studies completed, field entomology trial completed in Cambodia at the end of last year, And there's plans for an implementation trial to begin this year, and obviously Neil will talk more about that. And as I say, underneath both of those projects, there's mathematical modelling ongoing to predict the impact of these new tools which are being evaluated. So with that, I will say thank you, and either hand back to Leo or on to Neil for the next presentation. Thank you.
Yeah, Fred, wonderful presentation. Well done there. Nice, tight, crisp, clear, you know, on the details, but still a good comprehensive overview, embracing all the different projects and how it links in with Africa and with each other to some extent as well. So, and then very clearly, very well presented as well. So a great presentation. Thank you for that, Fred. Our next speaker is someone many of you will already know, and he is Dr. Neil Lobo. I might just mention Neil is sitting in the USA, where he is present now. It's about 2 a.m., somewhere around 2 o'clock in the morning. So I think we all take off our hats to you, and thank you, Neil, for your professionalism in staying up and sharing your experience and insights with us. Neil will talk on the topic of shifting the bite prevention paradigm. Neil is a research professor in the Department of Biological Sciences at the University of Notre Dame in the USA. Neil's research is directed towards collecting evidence that both elucidates the understanding of and also directs decision-making for strategies and policy targeting, and it targets diseases such as malaria and dengue. And the research done by him and his team directly supports multiple international Ministry of Health malaria programs. It's not standalone independent research. He does it in full collaboration with and addressing specific needs of these different ministries. So nicely integrated with real world teams in the specific countries involved. Neil works in many countries across the world. And as an example, just a month ago, he was in India helping APMEN in a 2-week vector surveillance course. Neil, thank you for your time. Over to you.
Hey, everyone, and good morning, afternoon, evening, whatever time it is. Let me share my screen. I hope that's working. So if you can see my screen, today I will be talking about shifting the bite prevention paradigm. So straight to the heart of the matter, what was the problem and what was our question we were tasked to deal with? So in Cambodia, as you probably know, there is persistent transmission amongst specific risk groups. And these people live in forests. They consist of forest goers, forest dwellers, and rangers. And you can see in the map of Cambodia, the red areas outline the higher transmission areas. And you can see a picture of how these people live, sort of in temporary structures. So our primary question was, how do we target and tailor an intervention strategy towards this forest transmission? So instead of delivering a talk that was very specific to Cambodia forest transmission, we thought of actually trying to make the lessons learned and the ways we sort of approach this problem applicable to everyone and anywhere. And what we've tried to do with this project, the BITE project, bite elimination towards bite interruption towards elimination, was to sort of focus on 3 paradigm shifts within our field that hopefully can increase protection and reduce malaria towards elimination. The first paradigm is understanding gaps in protection. And as a note, I will go through each one of these. The second is taking a staged approach to intervention evaluation, how to select an intervention, see if it works in your system, and then implement it. And the third paradigm is evaluating interventions based on how they actually function, because we know each intervention functions in different ways. Like, for example, bed nets and IRS are two interventions that function completely differently, even though both work indoors. So I'll go through each one of these paradigms. The first one is understanding gaps in protection. And towards this, we want to see where and when people are getting exposed to malaria bites, right? Because understanding this makes your question or what answer you want to deliver, right? You'd make it specific to where transmission is happening in your location or your area or your geography. This allows for targeting and tailoring, as well as the use of multiple intervention paradigms and products. And that's an important part of what we were doing. And just to go over this in a second, probably a minute, it's important to realize that interventions take advantage of susceptible mosquito behaviors. Let's say in this little scene, we have mosquitoes that bite, a specific mosquito species that bite outdoors, that bite indoors and outdoors, as well as just indoors. And we know there are locations where this actually happens. And now we have interventions and we deliver and implement an indoor intervention strategy. Now that indoor intervention, for example, bed nets, would work against those specific mosquitoes who are indoors, right? Susceptible, that mosquito species that display susceptible behaviors. And everything else outside that would be a gap in protection, because your intervention wouldn't necessarily function against those mosquitoes. So understanding these gaps of protection are really important to me. A lot of people will come out in presentations and say, we have 90% bednet coverage and 90% bednet usage, and we are doing a great job. And I completely agree, you are doing a great job. But understanding where your interventions are not functioning, where the gaps in protection are super important, because that is where you're getting all your malaria from. So understanding and characterizing that allows us to have targeted and tailored malaria intervention strategies. So what is a gap in protection? It is used to describe a circumstance where an individual or a household is exposed to malaria infection because there is a lack of an effective or adequate protective or preventative intervention in place to reduce that exposure. So if we look at this sort of diagram where interventions take advantage of mosquito behaviors, you can see the overlap is where you get protection. Now, really importantly, we have to overlap this with human behavior. For example, you can have every household with the mosquito net, but if they don't use them, they're ineffective. And now the overlap of all three is where you get protection. And that is what people usually measure and present at many presentations. But what we are saying we need to do is understand that, the gap in protection, how our interventions are not functioning. And that is where our malaria is coming from. Now overlay that with, let's say we have indoor biting in an area and bed nets work to a certain extent. Now understanding how extra interventions would function in that system is really important, because we can close the gap in protection. And this is where understanding how multiple interventions work together is really important, especially in atypical scenarios like in Cambodia, in the forest transmission systems. So here's the forest transmission system as an example. And the questions we would want to ask here are, where are people spending time? What are they doing when they're during those time periods? And overlay that with when are mosquitoes biting, and then try and understand what products fit in these spaces and times. Now within this Cambodia transmission system, right, we are looking at the exposure spaces and activities, as well as possible and potential intervention types. And so in these temporary structures where people sleep, we thought we could try and evaluate a passive volatile pyrethroid spatial repellent, and that's a VPSR. I'll be using that again because it's shorter. A spatial repellent spray, which is an active spatial repellent. The passive one is one you just hang up or leave around and forget about it. Whereas an active one would be something you'd have to spray and use. We thought of treated clothing as well as topical repellents. Now in areas outside those temporary structures, based on human activity, we thought the passive VPSR would work, the spatial repellent spray, treated clothing, and the topical repellent. And the last part is out in the forest, we'd look at treated clothing and topical repellents. And so we looked at human activity, what their behaviors were, and try to overlay that with how mosquitoes would function and how interventions would interact with them in those spaces. So taking a staged approach to intervention evaluation. Now that we thought of what interventions were, we wanted to take a staged approach. So the reasons for this would be evidence-based decision-making. It's responsible and ethical because we'd only move successful products to the next stage. It's cost-effective because we don't want to implement an intervention that doesn't really work, and it would save us a lot of money by only focusing on the ones that did work. We could evaluate multiple paradigms and products in the same areas to see which work best. Allows for targeting and tailoring. It allows human input, which is really important in some of these communities. For example, people not using their bed nets, right? We'd want to understand that before we implement bed nets. And we'd also understand further gaps in protection. In the BITE project, stage 1 consists of semi-field studies, which I'll go into. This was done in Thailand. Stage 1, overlapping with stage 2, was a formative assessment looking at user acceptability, so the human component, and this was done at our target groups in Cambodia. Stage 2 had an entomological field study, which followed the SFS study. The semi-field study was followed by a field study. There was a lot of control in the semi-field study, and in the field study, we take out a degree of control, and we'd look at wild mosquitoes. And the next stages are the implementation research, where we'd look at acceptability, appropriateness, operational feasibility, and so on, as well as hopefully an impact assessment, where we do a radical an RCT. Along every single one of these steps, we've done transmission modeling to understand from a modeling or simulation perspective what the outputs are and what the results were. And we'd fit our results to the model and vice versa towards generating a better model and understanding of the transmission and how our interventions impact transmission. The third paradigm is evaluating our interventions based on their mode of impact, mode of action. And an important point over here is that we looked at secondary endpoints. This is fair to the intervention. For example, trying to look at bed nets and how it impacts outdoor transmission, it probably doesn't impact it too much. And then it allows targeting and tailoring, as well as also lets us understand the very important gaps in protection specific to those interventions. So with secondary endpoints, if we look at this little diagram here, normally a mosquito would host seek, it would land, it would then blood feed, rest for about 24 hours, is probably alive, and 48 hours is probably alive, 72 hours it's probably alive, and then it lays eggs. Please note that the major thing everyone looks at and evaluates is usually the impact on landing with specific interventions. But what we realized when looking at mosquito behavior, that it is a lot more complicated than just that. So I'm going to walk through this really quickly. So what actually happens with an intervention is that a mosquito would host seek, just like the above. It would encounter an AI or an active ingredient, the insecticide on your intervention. And that's based on the intervention, right? And how it's exposed to it. And now 3 things might happen. It might land. And if it lands, it might blood feed or it might not blood feed. If it blood feeds, it would go through the same processes as above. If it doesn't blood feed, it might host seek, it might not host seek in areas without the intervention, right? And this might be diversion or not. And then it would go through the same 24 and 72-hour cycle, including death at each stage, because now it's exposed to an active ingredient, to an insecticide. It might be repelled. And if it's repelled, it might host seek or not. It might feed or not as well, and might go through the same processes, and it might be knocked down. And knockdown might result in death or not. So as you can see, the actual impacts by an intervention on your mosquito are far more complicated than just this landing. And what we actually found was that was really true. And note, we always only look at landing. So we're looking at secondary endpoints. In the semi-field system, we looked at 2 pyrethroid susceptible strains of Anopheles minimus, as well as the resistant and susceptible strains of Aedes aegypti. We used 4 interventions. One was a passive VPSR that was new and 20 days old. an active VPSR. We used Edofenprox treated clothing, both civilian uniforms, civilian clothing, as well as ranger uniforms, because this was directed at our target groups, civilians as well as forest rangers. And both types of clothing are quite different. One is thick and completely covers most of the body, and the other does not. We also looked at Edofenprox treated clothing plus 20% picaridin. And we realized based on the SFS results, and I'm going forward a bit, is that the picaridin was actually really helpful and increased efficacy of the Edofenprox treated clothing, because if you just had your clothing on, the mosquitoes landed on your untreated hands, and adding picaridin to that actually helped. So trying to understand mosquito behavior and what might happen in the system actually directed how we evaluated each product. The control of the comparator was identical without the intervention, and the landing and the outcomes were landing inhibition, which is what people usually measure, the impact on landing. We looked at immediate knockdown. We looked at mortality, both 24 hours, 48 hours, and 72 hours later. We looked at blood feeding inhibition and the impact on the number of eggs laid. The results demonstrated that when we look at personal protection, we did find HLC-based landing inhibition. And this is the measure that everyone usually measures, right? The impact on landing. But we also found that there was an impact on feeding. So mosquitoes would land, but not feed. And that's really important. They'd also not land, but not feed, because they were exposed to that active ingredient. So they just feel sick or not want to feed for whatever reason. They were also knocked down. And this resting plus no feeding or feeding inhibition, as we've categorized that as disarming and as feeding inhibition. So you can see this impact plus the mortality impact actually would offer community protection, because that would reduce biting on the community and people around that person. So with these personal protection interventions, we also get community protection, which was an important finding. Of course, we might also get diversion. And interestingly, what we found is that these interventions with the community protection reduce diversion, as in mosquitoes that did not feed would not feed on other people. We did not see in the SFS system an impact on diversion. An increased diversion. So what our results were the results are really good. We found an impact on almost with every intervention. And we now took these interventions to the field, where we evaluated them in the field. And you see this picture here actually has one of the structures under which we evaluated this. It's outdoor, it's a tarpaulin on pieces of wood in a forest system. Please note that all the results I show after this are based on something this wild and this out there, and based on our target group. These structures were that open. So now at this point in time, we think we've understood the gaps in protection and what modes of activity might fit these gaps, and therefore what interventions would be used. We think we've understood the problem, and we have controlled SFS data, and now we're taking this to the field. And please note, in the field, we cannot look at secondary endpoints. We can only look at the biting impact, because obviously we can't see mosquitoes that rest and don't feed, and so on. We also would expect community impact with this, and therefore we thought that these interventions, this down-selected group of interventions, would be what we would evaluate in this system. The 6 interventions we used in a 7x7 Latin square was the passive volatile pyrethroid spatial repellent. We used 4 kinds of treated clothing. 2 of them were Edofenprox treated, freshly treated, as well as 20 washes. And believe me, it's difficult washing clothes 20 times because we did it. And each of these Edofenprox treated clothing were combined with topical repellents. And this was data from our semi-field study that demonstrated that this was required to increase impact. We also had ranger treated uniforms that were freshly treated, and 20 washes, both also with the topical repellent. And then we combine them all, trying to understand in combination these volatile pyrethroid spatial repellents, the Edifant Prox treated clothing, as well as the topical repellent. How would they function together in the system, right? To combat multiple gaps in protection, as well as the negative control without anything. Now, I was there for these, I think 3 months of the study, and I was pretty amazed by the results, which are on the next slide. So over here on the left, you see the cumulative Anopheles per night, the number of Anopheles. This is just raw data. And you see on the bottom is the number of days, 49 days. And we found 3,537 Anopheles in the control. Now, these 4 interventions out here demonstrated a pretty big impact on mosquito landing only, right? Because we could only look at landing in this field system. And the VPSR, we caught only 138 mosquitoes, and combining all together, we caught only 124. So sort of understanding how interventions work together was actually pretty important, because we only caught 124 versus 3,537. This kind of blew my mind. I was pretty amazed by it. And if we actually look at statistically what happened, we look at the risk ratio, every single intervention demonstrated more than 50% impact on mosquito landing. This is just the stats part of it versus just raw data, which actually looks nicer to me anyway, but that's stats. So the next steps for Project Bite, when we're looking at these 3 paradigms, the first, when looking at staged approach, we've finished the SFS and the field, and we're looking at evaluating interventions based on their MOA. We've done the SFS, as well as understood gaps in protection for each intervention. And the next step is to look at implementation research for understanding gaps in protection and the staged approach, as well as hopefully RCT to look at epidemiological impact. The implementation research is starting next month. Is it next month already? It's starting next month. It's a 4-month-long project, implementation by local government. We're taking these successful interventions into this implementation research, and we're going to be implementing them in Plasmodium falciparum hotspots in Cambodia. The primary aim is to assess the intervention reach, fidelity, acceptability, appropriateness, coverage, and use of these tools among the high-risk target population. The secondary aims are to look at exposure risk, safety, to understand the continued gaps in protection, which are important, to look at economic aspects of it, residual efficacy, and operation feasibility, amongst others. And I think I've gone over time, so I would like to thank our funders and all our partners quickly. Thank you very much.
Neil, thank you so much. Excellent presentation, fascinating. And it's very encouraging to see the kinds of results you were getting there when you indicated more than 50% efficacy in each of the individual ones, and then it takes a quantum jump in collective efficacy once you start combining the different interventions. So all very encouraging. Well done to you and your team. We look forward to seeing what comes out of the implementation research, and in particular, social acceptability. You know, how do communities actually, how readily do they adopt these different measures? Well done, Neil. Thank you for that. We move on to our next speaker. Our final presentation is by Rebecca Vinnett, who will share with us her experience in working on the impact of indoor residual spraying as a vector control tool against malaria vectors in Papua New Guinea. Rebecca is a Senior Scientific Officer at the Vector-Borne Disease Unit, Papua New Guinea Institute of Medical Research, and she's based in Madang, where she has worked since 2015. She received a master's degree in medical entomology from Michigan State University and a BSc in biology and environmental science from the University of Papua New Guinea. So thank you, Rebecca. We look forward to your presentation. Over to you, Rebecca.
Okay. Greetings, everyone. Grab the screen. Can you all see the screen?
If you could just make it full screen, please, Rebecca.
Yep. Ooh, is this all right?
Yeah, that's great. Wonderful. Okay, please go ahead, Rebecca.
Okay, so this presentation is based on the effect of residual spraying on malaria vectors in a small-scale trial conducted in Papua New Guinea under the NATNAT project. So Papua New Guinea is ranked as one of the countries with the highest malaria cases and deaths in the Western Pacific region, according to the WHO report in 2021. Its major vectors come under the Anopheles punctulatus group, 3 of which can be morphologically identified, as you can see on the right of your screen: Anopheles varauti, Anopheles coliensis, and punctulatus. Other minor vectors includes Longirostris and Bancrofti. Now, as vector control tools, they are very important to eliminate vectors from transmitting vector diseases. And using insecticide-treated tools, it provides chemicals that kills vectors when in contact. The fight against malaria in Papua New Guinea has been a long fight since the 1960s, as you can see in the news paper article there that came out in 1975. The residual spraying campaign has been rolled out in PNG from the 1960s till the 1980s as the main vector control tool to control and eliminate malaria. Currently, the long-lasting insecticidal treated bed nets, or LLINs, are the only vector control tool used here. However, due to the upsurge of malaria reported in 2015 has a 9-fold increase between the years of 2013 and 17. There is a great need to integrate more than one vector control tool as a means to eliminate malaria by 2030. As Fred has outlined the aims of NATNAT project, these are its core objectives. So there are 3 priority vector control tools that will be trialed here. One is the residual spraying, the larval source management, and the spatial animators. And for this presentation, I will be talking about the residual spraying, and the objective is to conduct this using fluorofusion, which is a combination of 2 insecticides, deltamethrin and clothianidin, in a village setting in PNG to investigate the impact of RS on malaria indicators. So this small-scale trial was conducted in 4 villages along the north coast of Madang province in PNG. 2 villages were selected as our treatment village, as indicated by the yellow star. The other 2 by the red dots, Mirap and Wasab, were our control villages. And as an intervention being rolled out, acceptability studies before and after the RS trial was assessed, and also we investigated this impact of our malaria indicators using bi-monthly monitoring and evaluation in an interrupted time series of both entomology and epidemiological surveys. The results that I will be presenting moving on will be based on our entomological survey. So in our pre or before the RS trial was rolled out, we have conducted bi-monthly human landing catch as a good indicator for human biting rates for our major vectors and also minor ones. That was conducted in 2020 and it is still ongoing. It is a 12-hour collection, so over 4 nights, where 2 of which we have collected inside the house and the preceding 2 nights outside the house. This preliminary data shows from all of our 4 villages, you can see that there is a heterogeneous distribution of our major malaria vectors. In Magyar and Mirap, these are our coastal villages. It's predominantly Anopheles varauti, And in our inland villages from Bulal and Wasab, mostly Anopheles coliensis and punctulatus. So taking this heterogeneous distribution into consideration, the selection of our treatment village for conducting our residual spraying took the geographical setting of these. So one was taken from the coastal village and the other from the inland village. The resting collection survey was also an important survey tool for the to understand what are the potential resting sites of our vectors. And these potential resting sites will be defined as also sprayable surfaces. So this resting collection survey was conducted bi-monthly. As you can see, our collector with the Procopac, we sampled mosquitoes from 4 different zones, inside and also outside. As you can see from the underneath the house, all these surface areas were sampled. Along the veranda of the house, inside the house were the walls separately from the ceilings. Here is the preliminary data. From graph A, it shows that the mean number of Anopheles mosquitoes that were resting on these 4 different zones, and it clearly shows that at least all of these zones had a resting mosquito. And in graph B, this is the blood meal status of these resting mosquitoes. So we had a good proportion of fully fed mosquitoes, partially and also unfed, which indicates that vectors are using these surfaces to rest before and also after seeking their host. So taking this into consideration, we do identify these resting surfaces, and this was also considered in our residual spraying trial. So before the intervention was taking place, we had to conduct community engagement and awareness, and this took a lot of time and effort, as these communities have been exposed to IRS in 1950s. So it took us a lot of time to break that understanding, to explain the different insecticide use, the safety of it, and also how we went about the quality of spraying it. We recruited our spray operators from our study villages. We trained them, and we did a lot of planning in how we were to cover these villages in a time-efficient way. And this intervention was carried out in November of 2021. And this included not only spraying in and outside the house, we also sprayed the associated structures, as you can see in the picture up here, where it's an open area where people use to sit, and it's a potential resting sites for our malaria vectors. So the spray coverage in these treatment villages in Magyar was 88.9% of 225 houses. With its associated structures, it took us about 11 days to complete that village. And in Bulal, a more so smaller village compared to Magyar, it was 97.1% coverage of 105 houses, and that took us 5 days. So after the spraying was done, we continued on with our monitoring and evaluation of this treated village and also our control village. We conducted a wall cone bioassay, especially in our treated villages. This was done a month right after the IRS trial, and this data presented is for about 7 months. And as you can see, we used our insecticide susceptible colony red mosquitoes that were brought into these villages and set in a cone as shown in the pictures here. And they were exposed for following the WHO guideline. And this data shows our 24-hour mortality from the inside of the house and also the outside. And the red line right across is the 80% threshold for mortality rate. And you can see that there is a slight decrease in both the indoor and outdoor surfaces of the sprayed houses. And it is more pronounced in our outdoor surfaces than the indoor. We continued on with our human landing catches, and this graph from our treatment village from Megiar and Bulal, it shows the biting rates from each of these villages, showing a month before the RS trial was rolled out, indicated by the red line on the graph, and 3 months after the trial was conducted. The gray bar is our outdoor biting rates, and the blue is our indoor. Underneath each of those months from respective villages shows the composition of our major vectors indicated by the pie graph there. And you can see that with the high biting rates from either villages after the RS, there is a decrease in their biting rates. Now, this graph shows seasonality data from a year before the NATNAT project was conducted. And this is an overall anopheline biting rates from our indoor and outdoor collections. And with the gray shaded on this graph shows those peak period of our biting rates. And you can see that the month before RS was rolled out in November, it's starting to increase in their peak biting rates. Therefore, when RS was rolled out in the months in November, December, January, and February are our highest peak biting rates of our major vectors. And overall, it shows a decrease in the median biting rate for both the village, suggesting that RS may have cut into this peak period. So the next step in our residual spraying trial is to complete this rigorous field evaluation in its first trial, and that is to complete our entomological, epidemiology, and also acceptability monitoring. We are to also commence the second residual spraying intervention in November of this year. In this second intervention, we will be covering all our 4 villages, both the control and treated villages. We will be piloting a more program approach for the RS as a vector control tool that can be scaled up and implemented by the National Malaria Control Program in PNG. They've already commenced the pilot implementation trial planning in New Island province. And this was a master training workshop done with the provincial health authorities partners that was conducted in August. And this is a scale-up RS intervention with working partners under the Department of Health and also with our research collaborators. We would like to acknowledge people, our partners and collaborators who have assisted one way or another in making this trial work. Thank you.
Rebecca, wonderful presentation. Very, very interesting indeed. Yeah, lots of food for thought there. What I found fascinating was the combination in fluorofusion, the deltamethrin and clothianidin. If I understood your graphs correctly, it remains effective for at least 6 months before there's a significant decline in effectiveness, if I understood it correctly, which is quite impressive. 6 months, my goodness, that's not bad at all. And I think you pointed out that the real biting season is 3 months only. So even with a single application per annum, you're covering that peak transmission period, which is really great. I was going to ask you a question using moderator's prerogative and ask, I think there was a greater drop-off outdoors than indoors in the efficacy or efficiency. Does exposure to rainfall affect that interpretation? Presumably you're spraying more under, under the floor and under the roof, etc., outdoors. So rainfall would not have a direct impact, and there's some other factor that's causing the differential between indoor and outdoor efficiency. Is that correct?
Yes. For the rain aspect, during the month of November, we tried to do the trial before the rainy season kicks in. So we were aiming that period also to not be affected by rain.
Yeah. All right. Rebecca, again, wonderful presentation. Thank you so much. And thank you to all our speakers. Wonderful, really great information coming out there that I'm sure all of us, everyone in the audience, found very interesting. So it now comes to question and answer session, which is always I mean, the talks themselves are very interesting, but the Q&A session is the real value-added bit where people can ask questions from the experts and learn from their experience. So now's the time where we do this. We've got at least half an hour where we can to and fro in terms of questions and answers. I'm going to go from the top, in fairness to, to the audience members who posed questions. I think somebody stuck up their hand, but in fairness, again, let's first do a few of the written questions. I am only going to look at the Q&A box. So if you post questions in the chat box, please go back, copy and paste your question into the Q&A box, because, I can't, I'm just a male, I can't multitask so effectively. So I'm only going to look at the Q&A box. So the first one here is by Mohammed Farouk. And I'm assuming it addresses Neil's presentation. Just wondering how when the vector control tools will be publicly available, and how this will impact the affordability as well, and to know how the countries will benefit from it while the elimination goals vary between countries. I mean, you touch on several very interesting aspects there. Neil, this is more a prompt than, there are some specific questions, but it gives the opportunity to talk more broadly around the issue of community acceptability. Who pays for these topical and space sprays and impregnated clothing and so on? Will the communities have to pay for it themselves? Will there be subsidies? Will it be subsidized by any institution? How do you envision this moving forward? And of course, like every new tool, it takes time for these things to be mainstreamed. And I suspect by the time much of this is mainstreamed, malaria may have already been eliminated in the GMS. But as you pointed out earlier in your presentation, it's designed in a way that many of these lessons learned and the tools themselves can be migrated to other areas, including Africa. Do you want to speculate? Do you want to talk a bit around this, please, Neil?
Me or Fred?
Neil, I think the reference, to me at any rate, I interpret it as referring to the bite products being tested in forest goers. Yeah, so if you wouldn't mind responding to that, Neil.
So when will these be available? I think most of them are already available. And part of the implementation trial is actually to understand, the very important part of it is actually to understand acceptability and affordability. How much is a person willing to pay for these? So who will distribute these in the end? There are two sort of primary streams, right? One would be top-down distribution by the Ministry of Health or an implementation partner. The other would be bottom-up using of people going out and buying these products. And part of the implementation trial we're conducting is towards understanding this based on the product. How do people perceive it? Are they willing to spend money on it? So this is part of this upcoming implementation trial. Did that sort of answer it? Fred, would you want to add anything more to it?
Yeah,
Because,
thanks, Neil. I think that answers it. Just to kind of stress a point that I was trying to make on one of my earlier slides is that in all of these trials, we're not just trying to promote one manufacturer's product. We're looking at, if a product category is shown to be effective and efficacious, we would like to promote a wide range of products within that product category. So country programs and donors who are buying those tools and implementing them have a range of different products and active ingredients that they can choose from for their programs. And obviously the critical mass of products means that it's a competitive market and prices are kept fairly low and affordable. And just to your point, Neil, as well, yeah, so most of the products that we are testing here are available already in the market. And so what we're doing here is trying to evaluate the effectiveness, and when products are shown to be effective, then share that information and disseminate it, which should promote some purchase or procurement.
Yeah. As a quick add-on, Fred, part of our strategy is also looking at endpoints that we can measure towards understanding how different products in the same category sort of not match up to each other, but how they function within a system and how people actually like or don't like them. Because you can have two products that look the same and function and are used the same, but might function differently, and people might use them or like them completely differently. So we're sort of evaluating that as well.
Yeah, thank you, Neil and Fred. Good background there. So here's I think it's more of a comment than a question by Dr. Joshi. Hello, Dr. Joshi. Good to have you on board. He says, in the Solomon Islands and PNG, the major problems with anti-malarial drugs is that they are not properly administered by the malaria patients, and there's poor adherence to anti-malarial drugs. So it's an issue of compliance. Thank you, Dr. Joshi. Prudence, hello, Prudence, says here, have any of the studies included how these different interventions affect the insect populations in general, insects being essential in agriculture? There are good insects and there are bad insects. And unfortunately, what we do to inhibit the bad insects spills over into the good insects like bees and other pollinators and so on. And I'm thinking in particular, the outdoor spraying. I'm not making a judgment call here. It's just an observation that is interesting and does lead to questions. And also the ATSBs. I think there's a lot of concern out there about, the ATSB. Yes, it's covered with a membrane, and you need a mosquito to puncture the membrane and get into contact with the toxic substance contained within the membrane. But, at some point, that product is going to be discarded, lies in the sun, becomes brittle, cattle trample on it, and the membrane breaks. And the sugar remains attractive to things like butterflies, bees, etc. So I think it's a very valid question you're asking, Prudence. Does anyone want to venture an answer to that? Fred, Neil, anyone?
Sure. Yeah, so this is actually a really important part of any equation, right? The impact on non-targeted species, especially pollinators like bees and things. So this is part of the process that actually happens almost before it hits us for evaluation, where these products and paradigms need to be evaluated by the EPA, for example. They have to get cleared by them to demonstrate no long-term impact on other wild populations of things like bees. And for example, with ATSBs, the attractive toxic sugar baits, they've actually had to make the membrane such that bees can't feed through it, but other insects like mosquitoes can. And so there are things in process to try and alleviate this, but then there is that fine line, right? Of at what point are we trying to protect a moth that flies through your house versus mosquitoes biting you to prevent malaria. So there is that sort of line we have to straddle, and protecting humans versus protecting the local wildlife.
Yeah, and I would just add to that. I mean, this is obviously a huge priority for us as well at IVCC, and all of the products that are used in these trials and find their way into donor programs all are either US EPA registered or WHO PQ listed, and so there are stringent environmental safety standards that they need to reach. And so this is, this is something, as Neil says, is for the majority of the products that we're using, if not all of them, that's happened before we're starting to test them. However, in certain circumstances, we're still interested in gathering that information to see, what happens after use, or people don't always use these tools as they should use them, and there's off-label use for certain tools. So under certain programs, we're interested in understanding and collecting evidence and data on some of those other uses and other potential environmental impacts. So it is a big priority for us in vector control. We are kind of safeguarded to an extent in terms of EPA registrations and PQ registrations, but it's something that we're not not complacent on, and it's something that we always need to be mindful and look at once these tools go beyond exploratory trials and into wider use, and there's all sorts of tests and evaluations and data that can be gathered from these wider scale public programs as well, to make sure that the environmental assessments done at the beginning on these products bear resemblance to how they're being used in a scaled up way in the field.
Yeah, thank you, Neil. Thank you, John. I mean, yes, the products themselves may comply with very stringent requirements if used under the situations for which the regulations are relevant for. But once you start using bed nets to catch fish or various other uses, it comes into contact with a completely different target set of organisms. So one has to preemptively think of these things and try and build in measures to try and reduce the risks that come with that. So thank you. Thank you for the question, Prudence. Excellent question. So John Invest asks Rebecca and says, using only susceptible insects is not real life, as they do not exist in the wild. What is this? Rebecca, can you talk a bit around the issue of resistance, the level of resistance in mosquitoes, especially pyrethroid resistance in PNG, and in the area that you're working in? Do you have a good sense of the level of resistance there?
Thank you. For resistance, we are reporting resistance specifically to certain products such as DDT. As for pyrethroids, not so much, but it is to the fact that we are recently introducing it back to the use of our insecticide. But we have our monitoring surveys that are also ongoing to determine this. But with the resistance, we haven't picked it up yet in Madang province. So the mosquitoes that we are using to test for the wall cone bioassays, these are our colony red mosquitoes that haven't been exposed to any insecticide, and to determine like for the quality of the residual performance done on these treated villages, using these susceptible mosquitoes helps us to identify these 24-hour mortality rates. And also we have data for 48 and also 72-hour mortality rates too. And using susceptible colonies important for the residual performance of the insecticide used.
All right, Rebecca, thank you for that. Thank you. So here's a question from Tenzin Wangdi. Hello, my friend Tenzin. Good to see you here. I see the houses shown in the PowerPoint are made of bamboo mats. Were there also houses of concrete walls? And if they were, did the IRS efficacy differ between the two? It depends how you structured your experiment, presumably. But were you able to pick up any differences between materials used in the construction of dwellings? Rebecca, I think the question is probably targeted at you. The houses in your study area in PNG shows housing made of bamboo materials. So the question is that the predominant material for construction? Are there also concrete, cement structures? And were you able to detect any differences in your fluorofusion in terms of effectiveness between the two types of structures? Any insight there?
Yes. So the houses that are built in this rural setting, especially in our 4 villages, are mostly made up of bamboo and sago materials. So these are porous. We don't have any cement structures. It is basically wood, sago, and bamboo. Yeah.
All right.
Follow-up question. Sorry, I think I missed that.
It was, did your trial cover both cement and bamboo structures? And did you detect any differences in the efficiency of, malaria reduction or numbers of bites, human landing catches, or whatever, between the two sets of building types?
So we have only one set of the building materials, and mostly it is bamboo and sago palms. So we were not able to cover any houses that were made of concrete walls. And so we will only present that data for the efficacy on these materials.
Okay, so Rebecca, I can't help myself here, so I'm going to use moderator's prerogative again and make a comment here. There's been some fascinating, I find it fascinating, work done in PNG way ago. And I did some work in 1994 in Africa, which showed that if you, and there's been a lot more recent work that shows if you raise yourself even 1 meter above ground level, there's a dramatic drop off in biting rate, really impressive rate. So, there's a hidden, unrecognized advantage to the common practice in Asia of, at least in rural areas, of raising houses on stilts for very good monsoon-related reasons, etc. it has the side effect of you're actually reducing your risk of contracting malaria, at least by sleeping, a little bit higher off the ground. And even if you sit outdoors and socialize in early evening on a little platform, you are similarly reducing your biting risk. But, I mean, it's a bit of wishful thinking. Yes, it's a perfectly proven result. Raising yourself off the ground, provided it's open underneath, so mosquitoes fly through and they don't bounce up. They hit a vertical surface and they go boing, 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 and then they reach you. As long as it's open underneath, mosquitoes will fly through instead of flying up to go and find you up there. So I just thought I'd mention that, it's actually good to live in a house that's raised on stilts. But okay, what's happened with the questions that you put on there, Wulan? Okay, so Tenzin, I hope your question is answered. Here's a question from Ruben. And again, it's addressed at Rebecca. Great work, Ruben says. What was the impact on malaria after the trial on the incidence and also deaths? I'm not sure do you have any findings on that?
I was only able to present the entomological data.
Yeah, that was my impression.
Yeah, the epidemiological data is still coming together, and it'll still be presented in the near future.
Yeah,
for sure.
Yeah, no, hopefully it translates into epidemiological impact as well. Good luck there and well done, Rebecca. So Dave de la Cuesta, all the way from Philippines. Hello, Rebecca again. They're targeting you, Rebecca. Is it still possible to test other IRS insecticides for the second round of residual spraying planned in November? So it may be a little bit of an industry related question here, but is there space for testing other compounds, Rebecca?
For now, it is still in discussion. We are still considering fluorofusion, but the second residual intervention is still in the planning process. So I think that's when all of us sit down together and then we'll come up with an answer to this.
All right, Rebecca, I'm very sorry. You're still not off the hook. Clearly, your talk has sparked a lot of questions. Here's one. Well, it's not just one, it's multiple questions from Jeffrey. Jeffrey who, as usual, asks very, very thoughtful questions. And he asks, apart from the reductions in mosquito biting density or the human vector biting rate, did indoor residual spraying affect mosquito longevity, the Paris rate, the oviposition interval, and peak biting times?
Yeah.
So I'm not sure if you measured that, but do you want to just and then do you want to comment on that? And if you do, how do you explain these behavioral changes? Did you measure any of that, Rebecca?
Yes. So it is a short time period for this presentation, so I was only able to present the human landing catch. Yes, we did do the parity dissections. This data is yet to be put together. Definitely towards the end of this rigorous field evaluation, we will be able to come up with some good data on the longevity and also that oviposition interval with the peak biting rates. It's just that I only landing catch, and that was only foretelling the peak biting rates and the density of our mosquitoes. So Yes, we did collect that data.
All right, so you have the data, you're still analyzing it, and you're still going to put it together.
Yes.
So, Wulan, can I ask you to put it back up on the screen if you don't mind?
Sure, wait a minute.
I've lost the questions you had on the screen. Thank you. So here's one that I find very interesting as well. Thank you for raising it, Jeffrey. Is given the relatively long residual efficacy of up to 6 months or more, the high acceptability of IRS, and the negligible side effects of fluorofusion, how do you envision the role of IRS in burden reduction settings and for the control of active foci in elimination settings? So, I mean, there are a whole lot of things that go into that, the issue of, which is better? Is IRS better or are bed nets better? If you have a limited pot of funding, what should you do? Should you focus on IRS? Should you focus on bed nets? Should you do both? Usually you can't do both. It's just too expensive. People programs can't afford that. Or do you use them, bed nets and IRS, do you use it selectively to target different settings and situations? Do you have any comments on that at all? Anyone, but let's start with Rebecca, since Jeffrey posed the question to Rebecca. So let's start with you. I'm going to ask the same question of Neil and Fred, because this is an important question. Please, Rebecca.
Thank you, Jeffrey. So Papua New Guinea is a very diverse, both in geographical setting and as you can see in our vectors also. So using one way in controlling vectors is not enough to control and eliminate it, but integrating it. So by using these, understanding the bionomics and also the seasonality pattern of our vectors and their distribution, I think using more than one vector control is very promising, and not in one time, but targeting those times where you have high transmission rates, like the peak biting time. So at least having that, the parity data that comes in to understand the older mosquitoes, if we can target them, then it becomes more effective. The 6 months longevity of this insecticide is still good enough to affect, like lower that transmission impact. And in the long run, it does lower the incidences and also cases of malaria. So I do see it, if we can understand the modeling of our seasonality and placing our vector control tool good in the right timing and integrate that with all the other vectors, we will be able to lower that transmission, and in the long run also lower the incidence rates. Yeah.
Thank you, Rebecca. So could I, Neil, do you have any comments you'd like to make? Because yes, this is very relevant, especially to Africa as well, where the burden is massive. Yeah, and there's a very high level of insecticide resistance within bed nets. So I'd be interested to hear what you say, given your experience, you and Fred, in Africa as well.
Yeah. So at least to me, the selection of the insecticide, or the paradigm we're trying to implement, needs to be the most effective one based on where you are and what your mosquitoes and humans are doing. So if we look at baseline data and understand the largest proportion of your vectors that your intervention would get, that's the intervention I'd go for. So for example, if most of your vectors were resting on walls relative to, feeding on people late at night, I'd probably go for IRS versus LLINs, and vice versa. If most of your mosquitoes were biting people in the middle of the night indoors and not resting on walls, I'd go for LLINs. Note that WHO doesn't recommend both interventions at the same time with the same active for specific reasons, right? But the other important things to actually factor in, besides the overlap of how the intervention functions within your system, is the cost implications and how long they're effective for, because that's where the Ministry of Health and policy comes in, right? Can you afford can you afford intervention A over 3 years at the risk of taking intervention B for 6 months, right? Which would be more effective over longer periods of times, and what can you actually afford? And that's where all the policy decisions come into play, besides how interventions function.
Yeah, I'm very glad you raised that issue of cost, because very often that's the final determining factor. You know, what does it all cost? So it's a very complex question, and you know, NMCPs sit with difficult decisions they have to make. So it's not as straightforward as it may seem at first go. Fred, do you have any comments you'd like to make?
Nothing much more to add to what Rebecca and Neil have already said. Obviously, I think, you know, if money was no object, you know, we'd be looking at layering and integrating a range of different vector control tools with different modes of actions and obviously different AIs. We're not in that situation, and budgets, as you say, are a massive constraint. So we need to understand, I think, as much as we can about the local conditions, the seasonality, the bionomics, and use that to drive local decision making. And I suppose on the kind of the supply side that IVCC sits on, I guess, yeah, we need to make sure that with our partners, we try and make sure that the range or the menu of tools is as sort of broad and available as possible, so countries and donors can draw what they need according to the particular local and national conditions. And I think just to sort of draw it back to I think the original question, talking specifically about PNG and IRS and in you know, how it should be or could be deployed, whether, you know, switch out completely for nets or used just in you know, particular outbreak foci or elimination. So you know, perhaps Rebecca can maybe say a few words on this, but I know that the NATNAT team are in detailed conversations with the national program in PNG about doing some kind of pilot for IRS in New Ireland province, which is an island, and this would be bigger than the community trial that has been done on the north coast. Not a full, you know, national scale up, but within, you know, on that island, really trying to do something which is of a much larger scale and using IRS. I mean, I think the original plan was to look to see if it would be possible to try and eliminate malaria on the island using IRS. That might not be possible given the budget constraints, but that, you know, going back to the question about how that could be used, I know that that's something that in the near future that's been kind of discussed as a next step and a way of bridging from what's happened in the NATNAT trials in and around Madang, as a way of kind of understanding in what circumstances IRS could be scaled up and used in different ways. Sorry, Rebecca, you might want, I know that you've been talking a lot, but I don't know if you wanted to say a few words on that, the thoughts and the plans around the New Ireland province IRS spraying.
Well, the piloting of the IRS in New Ireland province, we only took part in training spray operators with the provincial health authorities partners, and it involves a lot of villages, and it is yet to be trialed. At the moment, we are caught up in between the second intervention that we will be carrying out in Madang, but in New Ireland province, it's much more on a bigger scale, as Fred has mentioned. on a bigger scale than Madang. So it is still in discussion, and we have yet to plan it out. Yeah.
All right. One last question. Rebecca, we're going to let you off the hook for a little bit. You can breathe, breathe deeply now for a moment. So it comes from our good friend, Tin Cho Thu. Thank you for joining, Tin. And it's addressed to Neil and Fred. Tin asks, he gives the prelude to his question, with expanded toolbox that comes with different price tags, in principle, this is needed, an expanded toolbox, vector control toolbox, but the fiscal space is unlikely to expand accordingly. You've got a pot of money that's targeting predominantly IRS and predominantly bed nets, and to some extent IRS, but there's increasing outdoor biting and a need for more tools. And as more tools become available, the pot of money is likely to stay pretty much the same. At one point, countries will have to prioritize the current tools, ITNs, IRS, which has already budget constraints to achieve full programs coverage target versus new tools. Do you envision we should aim to challenge the status quo? In other words, focusing overwhelmingly on ITNs and to some extent IRS, with a replacement by novel tools to eventually take over from our current primary use of ITNs? Or do we continue to take current position of these ITNs and IRS are core tools, and everything else should be complementary? That would mean the novel tools will always be secondary when it comes to prioritization. I just want to add this, that, you know, people say biting is shifting to outdoor compared with previously. That does not mean it's now exclusively outdoors and there's no more indoor biting. Biting is still, at least for a good number of species, our prime vectors. Gambi in Africa and Funestus in Africa and some other, you know, that's when people are asleep, they're defenseless. And that's when you need the bed nets. And that's when you're most exposed. There will always be a need for bed nets. You cannot say we no longer need bed nets and we're only going to shift to tools that cater for outdoor biting. So I suppose I've jumped the gun, but that, you know, I just wanted to make the point that even if there is a shift towards more outdoor biting, it doesn't mean biting is now exclusively outdoors. And there will always be a need to use bed nets. Neil, let's go to you first and then Fred. Any comments on Tin's question?
Yeah, give me at least 2 hours. I'm kidding. In short, I think we need to select the most effective tool within your budget for your targeted area and population. And this might be, and probably is, bed nets and or IRS, but other tools might work far better. For example, in our Cambodian forest systems where ITNs and bed nets and IRS do not work, right? They're not implementable. So based on your system, we need to select the appropriate tool. Yes, present global guidance focuses on ITNs and IRS because of the huge amount of evidence that demonstrates how applicable and useful they are. We don't have that sort of evidence for these other tools, which is what is sort of restrictive, right? Because people go with WHO guidance, and that's based on evidence and a whole lot of money that went towards it, but we don't have those resources for these other interventions. And that is what IVCC and BITE and we are trying to do here, generate some form of evidence for these alternative tools so we can understand their applicability and how they may function within these settings. Another important point is that when we implement an intervention, we immediately, intrinsically change transmission. we've changed it. And so we need to adapt how we respond to it. How do we monitor it? And the three major things we change are species compositions. For example, bed nets will kill off and impact indoor biting mosquitoes more, and IRS indoor resting, just as an example. Their behaviors, indoor feeding mosquitoes might start feeding more outdoors, as well as insecticide resistance. And all these three things compromise the efficacy of these interventions, whether they're ITNs, IRS, spatial repellents, or anything. So understanding how then intervention efficacy changes over time and being ready to adapt with novel strategies and other interventions is also a vital part of this process. Thanks, that's what I feel.
Thank you, Neil. Fred, any comments from you?
Yeah, thanks, Leo. I would say, I mean, it all needs to be based on evidence. So we need to work on building up the evidence base for these novel tools. And yeah, it's a great question, Tin, and it's way above my pay grade. But my view is that, you know, we need a plethora of tools. And as I said before, the tools that are deployed need to be done so, you know, taking into account budget questions, but also in terms of national and local conditions. And we need to make sure that there are a range of tools that meet varying conditions in different countries across the world. And we also need to be mindful of that those conditions will change. So there's going to be a whole number of environmental factors changing circumstances in the future. As Neil says, mosquito behavior changes as well. And so we need you know, a whole menu and a range of tools that can be used in different circumstances and at different times. So I don't think it would be a good strategy to just try and say, well, let's completely switch out ITNs and IRS for some of these more novel tools, because we'll find ourselves in a very difficult situation further down the line. So I think it's good to have, it's better to have tools that are on the shelf and perhaps aren't you know, used completely widely. They're there if there's a need for them in certain places and at certain times. So this idea of you know, integrating those different tools and layering them is something that I think that we need to be mindful of. But it's a great question, and yeah, certainly something that we yeah, as Neil says, we could talk for hours, I think, on this one.
Absolutely, yeah. So we've run out of time, very unfortunately. Our drop-off rate is increasing, losing audience, but we've had a good go at it. It's been a wonderful discussion, and I thank you, Neil, and I see Michael McDonald is also bright and bushy-tailed in the middle of the night, awake there. So to all of our audience members, a great big thank you for your interest, for the interaction you've shown, and to our speakers, Rebecca, Fred, Neil, sincere thank you for your contributions and your time and the inconvenience of being up at 3 a.m. And of course, to our technical team, also Dr. Porn, Popo, Wulan, many, many thanks indeed. To everyone, I'd like to ask, if you don't mind, there's going to be a poll put up on the screen. If you wouldn't mind spend, you know, it's going to take you a minute or so. I'd be very grateful if you could just help us by responding to those questions. But to everyone, see you next time. Next month, we've got another one